I'm Toleno from NR31 and I am now going to demonstrate the bag technique. Bag technique is a tool making use of public health bag which the nurse during his home visit can perform nursing procedures with ease, saving time and effort with the end view of rendering effective nursing care. The purpose or rationale of this bag technique is to render effective nursing care to clients or members of the family and community during home visit. I am now making a home visit to a 16-year-old pregnant client. I'm going to perform a procedure of prenatal checkup. I'm going to perform fundic height measurements, which correlates to the age of station of the baby. We're going also to perform Leopold's maneuver to the mother to identify the position of the baby in the mother's womb, as well as the engagement. The nurses making a home visit to high-risk pregnant client to prevent adverse outcomes, such as preterm birth, low birth weight, and small gestational age. These are the crucial indicators of child's health and development. Before arriving to the house of the client, make sure that the contents of the health bag are complete. So since we are going to visit a 16-year-old pregnant client and we're going to perform a prenatal checkup, we're going to have a tape measure, we're going also to have a stethoscope, and also alcohol and gloves are optional. We also need the other things that we are going to use like soap, apron, and the plastic lining and the paper lining. So upon arriving at the client's house, put the bag in a table or chair or any flat surface lined with the plastic lining and paper lining. So first is the plastic lining, and we should observe that the folded part should be facing the table, as well as the paper lining. The folded part should be facing the table. We should place our bag at the left side, and we should tuck the handle so we can work with ease. Having the table lined with paper lining as well as the plastic lining protects our bag as well as the contents of it from being contaminated. It's also the protection of the area from getting wet, and it also facilitates the creation of non-contaminated film. If faucet or running water is not available in the community, ask for a basin of water or a glass of water for the procedure of hand washing. Hand washing is very important because it prevents the spread of infection. The next thing we need to do is to take out the hand towel, the soap dish, and the apron so we can proceed to the hand washing technique. And we're going to put them in one corner of the table. So now we're going to proceed to the hand washing. We're going to pick up the towel and the soap dish. After doing the hand washing, we're now going to dry our hands with a towel. And now we're going to put them back in the bag together with the soap dish. Now we're going to proceed with the apron. So we're now going to put on apron, the right side out and the wrong side with crease touching the body, sliding the head into the next strap, neatly tie the straps at the back. So the next thing we're going to do is to take out all the articles needed for the specific care. And then we're now going to put them in a table. Next thing we're going to do is to take out the plastic trash or the paper trash outside the table. And now we're going to close our bag to prevent contamination. After taking out all of the necessary articles for this specific care, we're now going to proceed to the procedure of our checkup, which is prenatal checkup. And then before doing the procedure, make sure that you explain it to the client what we're going to do, and always ask their consent and always provide their privacy. We are now now going to proceed to the procedure of fundal height measurement. Here is my client, 16-year-old pregnant woman, and she is currently on her 25 weeks of gestation. Before doing any procedures, make sure that you identify the patient by her name and her birth, and make sure that she empties her bladder. And make sure the patient is lying down. So make sure also the environment is closed to protect her privacy. Always ask for the patient's consent. So now, ma'am, we're going to measure the fundal height of your baby. And may I touch your belly? Okay, thank you. So before touching the belly of the mother, make sure that you disinfect your hands with alcohol, or you perform an hand hygiene or hand washing. And before touching the mother, make sure that you warm up your hands. So we can now proceed, your mom. Thank you. So in measuring the fundal height of the baby, we're going to use the centimeter side. So starting from the symphysis pubis up to the fundus. So we're done, mom. Thank you so much. We're now closing your belly. So according to the measurement of the mother's belly, it is 25 centimeters, which is correlates and matches to her age of gestation. Therefore, the growth and development of the baby is normal. We're now going to perform our next procedure, which is Leopold's maneuver. Same as earlier, we need to disinfect our hands with alcohol and close the area which is provides for her privacy, and ask the mother if she emptied her bladder, and always ask her permissions before touching her. So now we're going to warm our hands and ask the patient if we can touch her. So now we're going, ma'am, to the next procedure. Can I touch your belly? Thank you so much. Now I'm going to explain to the mother the purpose of Leopold's maneuver. Ma'am, we're going to proceed to the procedure. So the purpose of this procedure is to know the engagement of your baby, the position of your baby, and we're going also to know where we can get her or his heartbeat. Can I now please touch your belly and remove the cover? Thank you so much. So in first maneuver, we're going to do is to place our hands in a triangle form, and we're going to know if the fundus part is the head part or the feet part. So gently press. So the head part should feel round and big, and the feet part should be squishy and tiny. We are now going to proceed to the second maneuver. We're going to find the baby's back. It's important because we're going to find the baby's heartbeat. So in doing this procedure, we're going to place our both hands on the both sides of the mother's belly, supporting each side, and the back feels of the baby is long and flexed, and the extremities are small and bent. So let's assume that the heartbeat is right here, which is the back is this part. So we're going to get the heartbeat of the baby while pushing the other side, so the heartbeat will be more accurate. We are now going to proceed to the third maneuver. We're going to know here if the baby's head is engaged or not. So we're going to place our fingers in the symphysis pubis in the L shape. So we're going to see if we can lift the baby's head up or not. So like this. If we can lift the baby's head, it means that it's not engaged, and if we are not able to lift the baby's head, it means it's engaged. We're now going to do the fourth maneuver. But before doing this maneuver, always remember that it can be done only if the baby's position and head position is in the symphysis pubis. If the baby is in bridge position, we cannot do this maneuver. So position your body at the head of the mother facing the feet, and we're going to start at the bottom. So this is to determine the cephalic prominence of the baby. The brow should be or the opposite side of the back. So now we're done with all of the Leopold's maneuver. We're going now to cover the mother and thank the mother for participating in the procedure. So now, after doing the procedure and the specific care and treatment to the patient, we are now going to clean, disinfect, and dispose the things that we used. And we are now using the tissue and alcohol. Now I'm going to dispose. And after that, we're now going to proceed to the hand washing again. So after hand washing, dry your hands with a towel and bring the things back into bag. I will now close the bag. So the next thing we're going to do is remove the apron out of the body, folding the soiled part inside and the clean side outside. And then folding it properly and bring back into the bag. Close the bag. And now we're going to fold the paper lining as well as the plastic lining and put it in the bag. For follow-up care, it's important to make a post-visit conference on matters relevant to healthcare. Also, for follow-up care, it's important to make another appointment for visit to the patient and explain to the patient why the next visit and next appointment is needed, and ask the patient for the date, time, and place where the visit may take place. That's all. Thank you.